The conference started a little over 15 years ago with Jeanette Berkeley Patton and some of the research she was doing with African American faith-based institutions and research.
One of our charges was to build capacity with our community partners to really be able to not only support the work that they were doing, but to also increase the capacity of collaborative work between community partners and researchers.
We wanted to do something to have a sort of annual celebration of partnerships between academic types who work in big institutions and community members who maybe work at small nonprofits or at small clinics in the community, or really do work to promote health in any way, but aren't necessarily connected to a big organization.
Here at the beginning, where I saw a lot of the connections occurring between the faith-based organizations, community-based organizations, particularly in the African American community.
Here at the Heartland Conference, we really prioritize those community advocates, and we try to make sure that their experience at the conference is one that is fun, while also being informative, and that really shows them that we appreciate the work that they do in their communities.
Oh my gosh, I love seeing everybody every year. There's people that return every year. You get to see people from all over the state and the region that you don't see unless you're at a conference. I love hearing people present for the first time and talk about their work for the first time, and just seeing people grow as a professional.
This conference is so accessible. There's real conversations happening, and people that are here to solve problems and make connections.
I love about the conference the equity, the opportunity for everybody. Everybody can have access independently of whatever they are, whatever they do, whatever their credentials are. Anybody has a voice.
Everybody's voice is heard, from researchers to health agency partners to community members, whether that's the grandma that lives down the street or, a stakeholder who's somewhere in government.
The conference values birth equity, and so we have been able to partner and have the conference sponsor us in our birth equity work, and also to bring that theme to the work that is being done at the conference.
Being able to hear speakers who are coming from all over and sharing their stories and keeping us motivated to keep doing this work, because it is not easy.
We get people from all over the region there, and we get different experiences and get to know the things that people are dealing with in their communities.
I'm just learning from folks who are already in the work and doing great things. And it's also impacted my curiosity. You can never have enough of it. And so I felt like I was a part of a family actually after leaving the conference.
Well, I think it's important for people to realize that what we're trying to provide here is a platform for folks to be able to really understand what's going on in our region.
The word that comes to mind when thinking about the conference is authentic.
Collaboration.
Equity.
Invigorating.
Energy.
Collaboration.
Community.
Equity.
Value.
Success.
Empowerment.
Opportunity.
Connection. I think the thing that we really focused on the last 5 or so years is really bringing people together for a reason, a real clear reason, a real clear theme, and having what we call basically a family reunion.